Hi there, I'm Dr. Jim. I have a good topic today, anticipatory grief associated with COVID-19. What do I mean by that? While many people are grieving the many losses associated with COVID-19, some may actually be experiencing anticipatory grief without knowing it. The difference between the two is all about time. Grief is experienced after a loss has occurred. You go through a bad divorce, you lose your job, you experience the death of a loved one. The event has occurred, and now grief follows. Anticipatory grief, on the other hand, takes place before anything ever happens. It involves more worry and anxiety about what is going to happen or what can happen. It's like there's a bad storm out there somewhere, except we don't know when it's going to hit, okay? Another way to explain anticipatory grief is fear of the unknown. We all know what that feels like, right? And a dreadful feeling that more bad things are on their way. Although we've learned many things about this virus, some people fear there's a lot more to know and that we should be worried about it. There's more that we don't know and we should be worried. That's a thought that they might have. Fear of the unknown is based on the future and what is going to take place or might take place. This induces a sense of what? I can't control the future, so I'm hopeless. It's going to happen. I feel helpless. I can't stop it. And I have anxiety. It can also make us feel like we have no control over what's coming our way. There are ways to determine if you or a friend or a family member is actually experiencing anticipatory grief surrounding COVID-19. Here are some things to ponder. A feeling of giving up, and whatever will happen, it's going to happen. Trying to emotionally and mentally prepare for the worst case scenario. Feeling exhausted, physically, emotionally, or both. Staying away from family, friends, or colleagues. I know people, I get so many people in my head that I know that fit each one of these. Feeling anxiety, fear, and dread on a regular basis. Being hyper vigilant or super prepared, super alert. And reacting strongly anytime somebody coughs, sneezes, or they're not wearing a mask. People freak out. Unusually strong feelings of anger and frustration about this entire thing, feeling helpless and out of control. While these signs might be indicative of anticipatory grief, one may develop anxiety or depressive disorders as well. There's evidence in the literature that post-traumatic stress syndrome, PTSD, is associated with COVID-19. There are cases. There are cases of sleep disorders, appetite disturbances, eating disorders, depression, anxiety, all associated with COVID-19. Some people are turning to substances like alcohol, street drugs, prescription medications. The first step, what do? Is we have to effectively look at the situation, try to base it in reality. That all begins with identification. We have to identify that we feel these ways or we know somebody that feels like this. It's healthy to accept it for what it is and not be ashamed or blame oneself for feeling this way. That's number one. Okay, I've identified that I feel this way. I'm not going to punish myself because I feel this way. It's actually pretty normal to feel this way. Instead of withdrawing, though, from people, that's not good. Gravitate towards them. Reach out to them. Help them to seek comfort in good, healthy relationships. COVID or no COVID, people need people, regardless of any situation. Take care of your physical, mental, emotional, and spiritual needs. And if all else fails, if you really do feel depressed, anxious, you're not sleeping, your appetite is a wreck, seek out professional help. And remember, you're not alone. There are a lot of people who feel this way. I'm Dr. Jim. Thank you for your time.